like to invite Samiya Abdi, who is now going to talk to us about the racialized impacts of COVID-19, as well as how diverse communities are responding. Samiya, off to you.
Hi, everyone. Thank you, Sumay, and thanks for everybody for attending. My name is Samiya Abdi, and I'm speaking to you today from Toronto, the land of the Misagas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people, and that Toronto continues to be home to many First Nation, Inuit, and Métis people from across Turtle Island. So with that, we just start with just recognizing that race is and racism is a social determinant of health, and racialization has impacted people's health through their life course. So this is with and without COVID. That we know that racialized communities experience, for example, a high rate of child removal through the Children's Aid Society, and particularly when we're speaking about both Black and Indigenous communities. We are also talking about the experiences of racialized communities through the school years, and that results in higher suspension rates, criminalization through the SRO, school resource officers program that is, placed in many school boards, and definitely which results in higher dropout rates, leading to higher underemployment and unemployment rates. And even when folks are employed, they tend to be employed in lower paying jobs, as well as, having unequal pay. We also know that racialized communities experience higher levels of poverty, have housing challenges, including overcrowding and unsafe housing. And with that, when we're thinking about the conversation around COVID-19 being hailed as a great equalizer, we know that because, early on we have seen that it's affecting politicians and some actors, and so the rich and the famous, and somehow thinking that everybody's going to experience it in the same way. But we know that not everybody will be exposed nor impacted in the same way. So now we know over the past week or so, the numbers are coming in, particularly from the U.S., and they're staggering. So, for example, the experiences of African Americans in Illinois, where 29% of the confirmed cases and 41% of COVID deaths are amongst African American. Meanwhile, they only make up 15% of that population. And things are even scarier in Chicago, where the numbers are closer to 70% of the deaths, COVID-related deaths, are amongst African Americans, and meanwhile the population is only 30%. In Canada, unfortunately, we're not able to account for racial differentials in terms of COVID, both COVID positive cases and COVID-related deaths, because we are not collecting racialized data yet. And there is actually a call out, I think, that came out last night from the University of Waterloo, folks at the University of Waterloo calling out for us to be able to count for this, so we're able to manage it accordingly. However, we inherently know that racialized communities and Indigenous communities will experience this in a very disproportionate measures, and will be impacted very differently. Some of the things that we are already seeing is, for example, the blatant acts of racism that continues to be experienced by the Asian communities, and these come in the forms of official statements, predominantly from the U.S. administration, but that also trickles down into our psyche. It comes down in the number of online memes and jokes and videos that we're seeing that is targeting Asian community particularly, and resulting in increased stigma, and loss of economy in terms of a lot of people refusing to be shopping in Asian-owned stores, whether they're grocery stores or other forms of stores, And also we are, hearing reports of actually increased violence against Asian community particularly. We are also seeing it from a public health and a healthcare system in terms of the diversion of services, equity-related services that are particularly for marginalized communities and racialized communities being diverted to COVID testing and COVID maybe contact tracing. And a good example of that is Indigenous patient navigators being redeployed in hospitals to be taken away from the service of supporting communities that would have challenges accessing the healthcare as it is to frontline COVID testing. And as Anjum mentioned, we also now know that racialized communities in general, particularly racialized women, are also overrepresented in jobs that are highly impacted. So we're talking about people who are working in the gig economy, people who are, all of our grocery workers, all our PSWs we're also talking about people who are doing custodial work in hospitals. And even though we're doing all these wonderful work celebrating our frontline staff in terms of doctors and nurses, but we're also forgetting that there is a system in place and a lot of people might be forgotten in that system. There is also a fear of seeking out help in terms of both undocumented and documented newer immigrants. And one of the things that Samiya and I were chatting about the other day was the increased policing that our communities are facing, given that there is particularly Indigenous and Black communities have been always, overrepresented and criminalized in terms of the measures that are coming in, such as the Emergency Management and Civil Protection Act. So thinking about the military rolling through the GTA yesterday and the media saying that this will create a sense of safety, but knowing that a lot of communities have not had that kind of relationship with the police or law enforcement. So thinking who will be disproportionately targeted, who will be when we have a documented history of carding in this country. The final thing that I wanted to also bring up is that yesterday I was reading that that in Brazil there is actually a real fear of the communities, the indigenous communities in the Amazon being wiped out by this disease, and knowing that even thinking about our own indigenous communities here and thinking about the lack of services that already exist, whether it's housing issues of crowding as well as lack of access to clean water. So we sometimes are putting forward as public health and health professionals measures such as shelter in place, continuous hand washing, social distancing, but realizing that all these things are things that people with privilege are able to practice, that not the people who are most vulnerable and are the ones who cannot stay home at times because they don't have maybe a home to stay at, and even if they do, that home might not be the safest to stay at. And more importantly, sometimes we do not have the things in place to support, the health and well-being of people as we are advising them. So as we're putting these universal approaches, that we need to make sure that they are coming along with targeted programs to support vulnerable and marginalized communities. So the one thing that I wanted to kind of end up with is what the second part of the question is what our racialized communities doing, how they're responding to. So there are two resources that I'll be sharing with you in the chat box after I finish talking. And one is, first of all, like places like the Black Creek Community Farm has started doing emergency food boxes at the beginning of this outbreak, even before things got to where we are today. And groups like the Toronto Council Fire is, providing meals and delivering services. So communities are bonding together and providing support for each other. There's translation services that are happening on a voluntary basis. So with all the challenges that we have in place, there is really an emergence of community solidarity and people supporting each other. But we also know that racialized communities and communities of color that might not have access to internet and might not have access to technology to stay connected will fall through the cracks. So I just wanted to remind ourselves as we are digitalizing that not everybody will be able to come along. Yeah, so I'm going to stop here and look forward to the rest of the conversation.
Great. Thank you so much for that, Sammy. I think you're really highlighting some challenges which existed for racialized communities prior to COVID-19. And again, I think we're seeing that clear theme that some the inequities which existed before this are just being amplified. You mentioned policing and what's happening. I just wanted to share that there is some work being done right now. The website is policingthepandemic.ca, and it's looking at instances of interaction with law enforcement, and that's being tracked. I don't believe it has information by race yet, so that's a good plug. I will. That's probably something we want to be monitoring at this point. You also talked about data and the limitations, and I know that is an ongoing challenge in the Canadian context. The fact that we do not have we don't record data by racial groups in our health system across the board. So for folks looking to do some work on that, like right now we're talking about COVID-19, which is, and in most places, it's being reported as it's a reportable disease. So each province has guidelines about what is supposed to be reported, and I just checked Ontario's recently, and it's not, you don't see race show up, right? So those are the opportunities we have to start to shift our practice. So for those of you who are actively involved in data conversations, start to check those documents and see what is required and how do we shift that.